Question 1. What does the presence of a delta wave on an ECG suggest? A. Atrial flutter. B. Wolff-Parkinson-White syndrome. C. Sinus tachycardia. D. Long QT syndrome. Answer: B. Wolff-Parkinson-White syndrome. Question 2. What is the priority action for a patient in stable monomorphic VT with a BP of 130/85 mmHg? A. Administer lidocaine 4. B. Prepare for synchronized cardioversion. C. Monitor rhythm closely. D. Administer adenosine. Answer: A. Administer lidocaine 4. Question 3. Which ECG finding is most concerning for a potential myocardial infarction? A. Sinus bradycardia. B. Peak T waves. C. ST segment elevation. D. Flattened P waves. Answer: C. ST segment elevation. Question 4. A patient with known atrial fibrillation is scheduled for cardioversion. What test must be done first? A. Troponin level. B. Chest X-ray. C. INR. D. Echocardiogram. Answer: D. Echocardiogram. Question 5. What is the typical heart rate in junctional escape rhythm? A. 20 to 40 BPM. B. 40 to 60 BPM. C. 60 to 100 BPM. D. Over 100 BPM. Answer: B. 40 to 60 BPM. Question 6. A nurse identifies a run of ventricular tachycardia on telemetry. The patient is awake and talking. What is the priority? A. Begin CPR. B. Administer adenosine. C. Assess vital signs and symptoms. D. Defibrillate immediately. Answer: C. Assess vital signs and symptoms. Question 7. What condition is most associated with prolonged QT interval? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hyperglycemia. Answer: B. Hypokalemia. Question 8. Which rhythm has absent P waves, narrow QRS, and a rate of 150 to 250 BPM? A. Sinus tachycardia. B. Atrial flutter. C. Supraventricular tachycardia. D. Ventricular tachycardia. Answer: C. Supraventricular tachycardia. Question 9. A telemetry strip shows irregular rhythm, no P waves, and fibrillatory baseline. What is it? A. Atrial flutter. B. Sinus arrhythmia. C. Atrial fibrillation. D. Junctional rhythm. Answer: C. Atrial fibrillation. Question 10. What is the expected pacemaker setting for complete heart block? A. Demand mode AI. B. VVI pacing. C. DDD pacing. D. Fixed mode AO. Answer: C. DDD pacing. Question 11. A patient with third-degree AV block is unconscious. What is the first nursing priority? A. Prepare for synchronized cardioversion. B. Administer beta blocker. C. Start CPR and pacing pads. D. Place on telemetry. Answer: C. Start CPR and pacing pads. Question 12. A nurse identifies ventricular bigeminy on ECG. What does this mean? A. Every second beat is a PAC. B. Every second beat is a PVC. C. Two PVCs occur together. D. Every second beat is a junctional beat. Answer: B. Every second beat is a PVC. Question 13. Which of the following is the most appropriate intervention for a patient in stable atrial flutter with HR 125 BPM? A. Administer amiodarone. B. Defibrillate. C. Perform vagal maneuvers. D. Administer atropine. Answer: A. Administer amiodarone. Question 14. What is a distinguishing feature of second-degree AV block type 2? A. Progressive PR lengthening. B. Dropped QRS complexes without PR changes. C. Regularly irregular rhythm. D. Wide QRS with every P wave. Answer. B. Dropped QRS complexes without PR changes. Question 15. A nurse notes tall, peak T waves in a dialysis patient. What electrolyte imbalance is likely? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. Answer. A. Hyperkalemia. Question 16. What medication is contraindicated in complete heart block without a pacemaker? A. Atropine. B. Epinephrine. C. Amiodarone. D. Adenosine. Answer. D. Adenosine. Question 17. A nurse finds a patient with HR 50 BPM, BP 90/60ths mmHg, and dizziness. What's the first step? A. Call the provider. B. Start a dopamine drip. C. Administer atropine. D. Prepare for defibrillation. Answer. C. Administer atropine. Question 18. A nurse observes pacing spikes not followed by QRS complexes. What is this called? A. Failure to sense. B. Failure to capture. C. Failure to pace. D. Oversensing. Answer. B. Failure to capture. Question 19. A nurse is reviewing a rhythm strip and sees one P wave for every QRS and a rate of 85 BPM. What is it? A. Atrial flutter. B. Normal sinus rhythm. C. Junctional tachycardia. D. First-degree block. Answer. B. Normal sinus rhythm. Question 20. What is the primary goal when managing a patient with unstable tachyarrhythmia? A. Monitor rhythm for 6 hours. B. Slow down the rhythm using medications. C. Identify the underlying cause. D. Restore perfusion quickly. Answer. D. Restore perfusion quickly. Question 21. What distinguishes PEA, pulseless electrical activity, from other rhythms? A. Organized rhythm with a pulse. B. Electrical activity with no mechanical output. C. No rhythm on ECG. D. Chaotic ventricular rhythm. Answer. B. Electrical activity with no mechanical output. Question 22. Which patient scenario requires immediate intervention? A. Atrial flutter with HR 88 BPM and no symptoms. B. Sinus bradycardia with HR 58 BPM and alertness. C. Ventricular fibrillation on monitor with no responsiveness. D. Junctional rhythm with HR 55 BPM and BP 118/70 mmHg. Answer. C. Ventricular fibrillation on monitor with no responsiveness. Question 23. A nurse sees a regularly irregular rhythm with group beats. What does this suggest? A. First-degree AV block. B. Sinus arrhythmia. C. Wenckebach-Mobitz I. D. Third-degree AV block. Answer. C. Wenckebach-Mobitz I. Question 24. Which intervention is not appropriate during a code for asystole? A. High-quality CPR. B. Epinephrine administration. C. Defibrillation. D. Identifying reversible causes. Answer. C. Defibrillation. Question 25. A nurse sees two PVCs back-to-back on a strip. How is this documented? A. Bigemini. B. Couplets. C. Triplets. D. Salvos. Answer. B. Couplets. Question 26. What should be done first for a symptomatic patient with complete heart block? A. Administer adenosine. B. Begin CPR. C. Prepare for transcutaneous pacing. D. Start dopamine drip. Answer. C. Prepare for transcutaneous pacing. Question 27. What does a prolonged QT interval increase the risk of? A. Bradycardia. B. Torsade de pointes. C. Junctional escape rhythm. D. Sinus tachycardia. Answer: B. Torsade de pointes. Question 28. Which ECG rhythm often presents with chaotic, disorganized electrical activity and no cardiac output? A. Atrial flutter. B. Atrial fibrillation. C. Ventricular fibrillation. D. Supraventricular tachycardia. Answer: C. Ventricular fibrillation. Question 29. What electrolyte disturbance is commonly associated with flat T waves and the presence of U waves? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Answer: B. Hypokalemia. Question 30. Which is a defining characteristic of sinus arrhythmia? A. Irregular rhythm with absent P waves. B. Irregular rhythm that changes with respiration. C. Regular rhythm with PR variation. D. Rhythm with inverted P waves. Answer: B. Irregular rhythm that changes with respiration. Question 31. What is the best nursing action after seeing pacemaker spikes without QRS complexes? A. Silence, telemetry, alarm. B. Document findings and monitor. C. Notify the provider immediately. D. Reposition telemetry leads. Answer: C. Notify the provider immediately. Question 32. Which condition is most likely to develop into ventricular fibrillation if untreated? A. Atrial flutter. B. Junctional bradycardia. C. Polymorphic ventricular tachycardia. D. Sinus arrhythmia. Answer: C. Polymorphic ventricular tachycardia. Question 33. A nurse finds a pulseless patient with an ECG showing electrical activity. What rhythm is this? A. Sinus bradycardia. B. Asystole. C. P. D. V-Tach. Answer: C. PA. Question 34. A nurse sees a QRS duration greater than 0.12 seconds with a regular rhythm. What could this indicate? A. Supraventricular tachycardia. B. Ventricular tachycardia. C. Atrial flutter. D. Sinus tachycardia. Answer: B. Ventricular tachycardia. Question 35. A patient has frequent PACs, but is asymptomatic. What should the nurse do? A. Start oxygen. B. Notify the provider urgently. C. Monitor and reassess periodically. D. Begin CPR. Answer: C. Monitor and reassess periodically. Question 36. What condition presents with irregular rhythm, absent P waves, and narrow QRS complexes? A. Atrial fibrillation. B. Junctional tachycardia. C. Ventricular tachycardia. D. Mobitz 2 block. Answer: A. Atrial fibrillation. Question 37. What's the best intervention for a conscious patient in narrow complex SVT, HR 195 BPM? A. Give a amiodarone. B. Administer atropine. C. Instruct to bear down vagal maneuver. D. Perform synchronized cardioversion. Answer: C. Instruct to bear down vagal maneuver. Question 38. What does a consistent PR interval with dropped QRS complexes suggest? A. First-degree block. B. Second-degree block type 2. C. Second-degree block type 1. D. Third-degree block. Answer: B. Second-degree block type 2. Question 39. A nurse observes torsades de pointes. Which medication should the nurse prepare to administer immediately? A. Atropine. B. Adenosine. C. Magnesium sulfate. D. Calcium gluconate. Answer: C. Magnesium sulfate. Question 40. A patient is an SVT and remains unstable despite vagal maneuvers and adenosine. What is the next step? A. Defibrillation. B. Repeat adenosine. C. Cardioversion. D. Administer atropine. Answer: C. Cardioversion. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!